In Nigeria, the deadly Ebola virus has claimed another life, bringing the fatality count up to 3. The victim was a staff member at the Lagos Liaison Office of the Economic Community of West African States. CCTV's Deji Badmus has more on how the recruitment of medical workers is getting more challenging.
They are at the heart of the fight against Ebola, but they are now among its victims. More than 60 medical workers have died of the virus in Liberia, Sierra Leone and Guinea, and that number is growing. In Nigeria, 1 nurse has died and at least 5 other medical workers are infected, quarantined in this isolation ward in Lagos. The challenge before the Nigerian government is to mobilize more medical workers.
Ebola is a particularly risky option when a doctor thinks about the challenges that you have to deal with.
Dr. Mike Ibeabuchi of the Department of Anatomy at the University of Lagos Teaching Hospital says one hindrance could be ignorance.
The biggest risk was because of the knowledge base. The more people are educated about it, the more willing, the more ready they will be to accept a volunteer. Once you can define the level of contact, so people who volunteer at different levels.
The government has promised life insurance for any medical worker who volunteers. But Ibeabuchi says that may not be sufficient incentive.
It's good, but that's not what is going to make a doctor volunteer. No, the volunteer is going to be somebody who says, I have an overriding interest in making sure that this case is dealt with.
As a senior doctor, Ibeabuchi will have to help in treating Ebola patients should he be called in. So how does this one doctor protect himself and his family?
The most important thing is to ensure we have running water. Because with running water and with soap and with something as simple as sodium hypochlorite, bleach, that's enough protection. People should not panic. Ebola is a knowledge-driven condition. Public health, maintenance, prevention is about what you know.
As part of that prevention, his department is accepting no more corpses for dissection until the crisis is over. Deji Badmus, CCTV, Lagos, Nigeria.